If you enjoy the great outdoors, you already know that the Pacific Northwest is a hiker's dream. But today we're going to talk about Achilles tendonitis, a subject that, if ignored, could put a damper on your hiking plans this season. Today I'm going to talk to you specifically about how to stop Achilles tendonitis in hikers. But before I do, I'd like to introduce myself. I'm Dr. Ryan Berg, and I've been in practice in podiatry for over 40 years in Seattle, Washington. I've written an ebook to help you find the perfect hiking boot to help prevent Achilles tendonitis and its cousin, plantar fasciitis, called How to Buy Hiking Boots to Prevent Plantar Fasciitis. Please check it out in the description below. If you find this information helpful, please remember to like, hit the subscribe button, and then hit the bell so you can receive notification every time I release a new video. As I just mentioned, Achilles tendonitis is a close cousin to plantar fasciitis, the most common cause of heel pain and one of the most common conditions I treat in this office. That's because it has many similarities to plantar fasciitis in terms of what causes it and how to treat it. The culprit is the Achilles tendon, which can be found in the rear of your heel. It is joined to the ligament that is responsible for the inflammation related to the plantar fascia. Let's first examine the causes and risk factors for developing Achilles tendonitis in hikers before going any further. We can avoid this overuse injury from disrupting hiking excursions by recognizing these elements. First, sorry guys, but men are at higher risk for Achilles tendonitis. It can also affect people with flat feet with a tendency to overpronate, and affect people with tight calf muscles that put too much strain on the Achilles tendon. And it's even aggravated by certain specific medical disorders like psoriasis and high blood pressure. Certain drugs, including the fluoroquinolones, the one that's known Levaquin, L-E-V-A-Q-U-I-N, can cause Achilles tendonitis and even lead to rupture. But there are additional causes to be aware of besides these just mentioned. Achilles tendonitis is more likely to occur if you run up hills frequently, don't spend enough time warming up, wear boots that are worn out, or aren't appropriate for the type of hiking you're doing. In addition, taking hikes that are very long or have a lot of elevation gain too soon after not hiking for many months can increase your risk of trouble. Now let's look at the symptoms and talk about treatments we have in our Seattle office. There are various unique symptoms that define Achilles tendonitis. Here are some of the specifics to be aware of. Just below the calf muscles above the heel, hikers may feel a slight ache. While hiking, this soreness eventually gets worse. Achilles tendonitis can cause pain, discomfort, and tenderness. These symptoms are most obvious when getting out of bed in the morning. Squeezing the Achilles tendon side to side may cause sensitivity or severe pain, which is a sign of increasing inflammation and damage to the affected tissue. In some instances, the tissue of the injured tendon may produce nodules or thickened patches. These nodules may also aggravate existing pain and suffering. It's critical to get help right away if you notice any of these symptoms developing. Achilles tendinosis and Achilles tendon rupture, two additional disorders linked to Achilles tendon strain, might develop if treatment is put off. If Achilles tendonitis is not completely cured, these more severe conditions are more likely to happen. Let's examine now the therapies offered to hikers with Achilles tendonitis. First is rest. This may be extremely important. Hiking with Achilles tendonitis and pushing through it will only make the problem worse and take longer to heal. Resting the injured foot is crucial for the tendon to heal completely. Second, ice. Ice is nice and can effectively reduce inflammation by being applied to an affected area like the tendon, 20 minutes on and 20 minutes off. This can bring about much needed temporary relief. Third is the use of an anti-inflammatory medication. Taking an anti-inflammatory drug as directed can help with pain relief, but more importantly, reduce the inflammation, which promotes healing. Fourth is using a walking boot. For full recovery from a significant Achilles tendonitis, it may be necessary to wear a boot and immobilize that extremity well above that ankle. Your podiatrist will advise you on the proper duration and usage of a walking boot. Fifth is custom orthotics. We provide both conventional and cutting-edge 3D printed orthotics at our Seattle office. These special inserts can enhance your foot biomechanics and lower the risk of reoccurring Achilles tendonitis. Sixth is stretching the calf muscle. This is important for everyone hiking. Achilles tendonitis can be exacerbated by tight calf muscles. Regular calf stretches can help lower your risk of recurrence. You may also want to consider using an Achilles splint if you have significant tightness. You can learn more about how to use this device in the video above. Seventh is MLS laser therapy. Cold laser technology is used in state-of-the-art procedure to quicken the healing process. Your recovery from Achilles tendonitis can be greatly accelerated with this revolutionary treatment. It is usually preferable to prevent Achilles tendonitis rather than to treat it. Here are 5 crucial actions you may do to prevent this condition. First, invest in hiking boots or shoes that are appropriate for the amount of hiking you do and the kind of trail you're going to be on. Download my book, How to Buy Hiking Boots to Prevent Plantar Fasciitis, to learn about choosing the best hiking boots and preventing both plantar fasciitis and Achilles tendonitis. Second is stretching. It's important to warm up properly before you start the hike. Include static calf muscle stretches, holding each extremity for at least 90 seconds in the proper position, as well as dynamic stretches to help your muscles get ready for the physical demands of hiking. We'll include a link for how to do dynamic stretching in the description below. Third is replacing your insole. If you don't need orthotics, think about using an over-the-counter insert like Power Step, Superfeet, or Ready Orthotic to replace the insole that comes with the boots. These inserts can offer much more cushioning and support, which will ease the strain on your Achilles tendon and hopefully prevent Achilles tendonitis. Fourth, be sure to increase your distance and elevation gradually. Slow is the winner. Increase both of these only 10% a week and avoid pushing yourself too hard. This enables your body to recover during your hike, to adapt and become stronger over time. Number 5, be sure to include strength and flexibility exercises in your training program to lower your risk for Achilles injury. Consider weightlifting, yoga, light jogging, or something like an elliptical trainer. For more information about how to stop Achilles tendonitis on and off the trail, please refer to my video, How to Stop Heel Pain in Hikers. You can find it here. In conclusion, if you want to keep hiking and prevent Achilles tendonitis, use the 5 actions we just talked about. However, if you notice symptoms of this type, give us a call right away. Let's get you treated so you can enjoy the rest of your hiking season in a healthy manner.